Again, good day to everyone. I would like to welcome you all to this much anticipated Zoom interview with our very important guest today. So before I introduce him, let us first take the time to introduce ourselves. So, sir, we are a group of students from the Master of Arts in Nursing program of the University of the Philippines Open University. So actually, as a group, sir, this is our first time to meet virtually. Some of us are, most of us are here in the Philippines, though some are already based offshore. So thanks to the advent of technology that this event is already possible. Okay, so let me start by introducing myself. Then I'll call on your names and you may share a few things about yourself. So our speaker may get to know each of us. So my name is Rufa De Paz. I am currently working as the head of the Quality Assurance and Nursing Research Unit of the Nursing Services at the National Kidney and Transplant Institute. So I've been in the profession for 11 years and I'm very much delighted to be with all of you today. Okay, so may I call on our leader, our very efficient Mr. Franz Francisco, to say a few words. Sir Franz?
I think he has technical problems, ma'am, with his mic.
Yeah, okay. I can hear you, and I can see you too. Who's this?
Sorry, sir. Sir Franz, I think he has technical problems with his audio.
I see. Oh,
okay,
I thought it was you.
Sorry.
All right, sige. Okay po, sige po.
There you go.
Is there na? Okay po.
Hello.
Hello, yes.
Hi, Dr. Locsin. Good evening po.
Yeah, hi.
Sorry, there's a bit of a technical difficulty on my end. Do apologize, sir.
No problem. Right.
Okay. All right. Okay. Ma'am Rupa, where we're at?
So I was introduced. This is the part where we introduce ourselves. So okay. I was calling you to say a few words as the leader of this group.
Oh yes. So first of all, I'd like to greet everybody and welcome to this lovely opportunity of interviewing one of today's great nursing theorists of our time. I also so the purpose of this interview and this meeting is also to gain an in-depth understanding of the theory on technological nursing, and I would also encourage everybody to try to raise some questions, to actively participate throughout the discussion. We'll try to keep it short, Dr. Locsin. I understand how late it is in the evening on your end over there.
It's okay. It's only 9 o'clock in the evening, so I'm fine. All right.
Okay. Right. So yes. So again, my name's Franz. I am the leader of the group, and I'm glad to meet everybody here virtually, and hope you all are safe on your end. I understand with this pandemic, it's a bit difficult. Right. So yeah, so my name is Franz. I'm the leader of the group. If have the rest of the participants introduced themselves?
Not yet. You're the first. You're the second one to introduce her.
All right. All right. So I'll let the other members introduce themselves before we go on with the interview proper. I'm Jenny. Sorry. I'm Jazeel.
Okay. Hello po. I'm Jazeel. I am a pediatric nurse. Hello, sir. Good evening. From Philippine General Hospital po. I've been here since 2017, and I'm excited about this interview we have.
Okay, very good. Same here.
So,
Ma'am Nerys?
Actually, Ma'am Nerys is our Deputy Executive Director for Nursing Services here at KTI. She will be joining us.
Okay.
Yeah, for this session.
Okay. Mr. Layo?
Yeah.
Hello. Hello, sirs, and hello, ma'ams. I'm Aisezo Barlayo. I'm currently working for the Armed Forces of the Philippines, currently assigned with the Philippine Navy. I am assigned here in a medical dispensary in San Antonio, Zambales. Prior working to government, I've been in the private hospital for 3 years and a half. So it was really challenging from knowing ideal setup from the government setup. And with regards to this theory, it's really a challenge because there is a big gap wherein I believe the study was done to first world countries, and it's really a challenge as well for the Philippines to catch up with such technology and the nursing care itself. And yeah, it's so good to be here as well with the rest of the class today.
Yeah, welcome.
Thank you very much, sir. Can we hear from Ma'am Eileen?
Hi, how are you doing? Good evening, good day. My name is
Good evening. It's okay. Yeah, it's 9:00 p.m. here, so it's fine. Yes.
Yeah, I'm currently in Bermuda right now, and I'm working for the only hospital here. It's the King Edward Memorial Hospital, and I am an assistant clinical manager and clinical resource for my intravenous infusion team. There is a small team, it's only like a six body in our team. I am very proud of the technology that we've been upholding in our department. We recently started using the Vigan. That is a new midline external dwelling that we are trying to promote in our hospital. That is a new technology that we are trying to promote, and it's something. It's a tackle that we're trying to get the hospital get on board with us. Yeah.
Very good. Very good.
It's
Yeah.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
All right. Can we hear from Sir Manny, please?
Hello, sir. Hello. Can you hear me?
Yes,
Yeah.
we can hear you,
Yes.
sir.
Hello, sir Locsin, and to my classmates, good morning. So,
Good
unfortunately, I
morning.
cannot open my camera.
No.
I just woke up. Medyo nagulo pa yung
That's
hair ko.
alright.
By the way, I am First Lieutenant Manuel Hintoba. I am a military nurse in the Armed Forces of the Philippines. I am currently deployed here at the military treatment facility. It's actually a COVID facility where we are treating a severe or critically ill patients suffering from COVID-19. But before that, I was also deployed from the different military treatment quarantine facilities. And then actually, right now, I am on process. I am actually for reassignment in Mindanao. So I'm really have a hard time with my schedule, considering that I am on my exit call and ito pa, may COVID pa. So I look forward to learn a lot this day, and I'm so happy to meet my classmates. So it just happened I cannot open my camera, but it's nice to see you all. Good morning.
Yeah.
That's perfectly fine,
Right.
Sir Manny.
Yeah.
Sir
Thank you, Manny.
Aljon?
Hello, sir. Good morning po. Good morning, Sir Locsin, and
Yes.
to the rest of my classmates. Sir, I'm sorry pa. I am presently at work, but I can't open my camera. I am very intrigued with your theory, especially here in the Philippines, where at present the technology is not yet that advanced as compared to uh, the other countries. I will very much happy to learn about what will be our discussion today here. That would be all. Thank you.
All right. Thank you.
Sir Carlos? Sir Carlos Diniega? All right. What about from Carrie? Right. I understand. I think some of our participants. Oh, hello, Ma'am Carrie. Can you hear us?
Good morning.
Hi, good
Good
morning.
morning.
Hello, everyone. Good evening, Dr. Locsin. I'm Karen
Hi.
Faustin Now. I am a nurse manager at Early Day Flores Hospital here in Manila. So I am handling 3 departments under the Ancillary Services Division. So I've been in the practice for 13 years. 3 years here at Our Lady of Lourdes Hospital. I've been to different institutions. I originally started at Cardinal Santos Medical Center as an endoscopy nurse. So that's really my my working experience. I started as an endoscopy nurse, and working in ancillary division, we are really exposed to the different machines, different equipments, because that's the one we are using for us to be able to deliver care to our patients. I am very excited to learn from you on how can we really adapt with this kind of technologies. I'm very happy to see you guys. Naka-duty lang din po ako ngayon, so I'll be turning off my camera later. Thank
Okay.
you.
Thank you.
Thank you.
And Sir Carlos, you can hear us?
Hello? Hello?
Hi,
Can you hear me?
Carlos. Yes, we
Okay.
can hear you.
Hello? Hello, good day, good evening, good morning to everyone. So, I'm Carlos
Okay.
Duniaga. I am an emergency nurse working here in UAE. It's 5 a.m. today. Thank you, Dr. Locsin, for accepting our interview, because it's not every day that we get to see or interview a nursing tourist.
Thank you. Yeah.
Okay.
And I think lastly we got Mom April.
Hello.
Hello.
Wala.
Hello.
Hindi na ako kasama sa inyo. Hinahanapan nga ako ng ng report.
Hello, everyone.
Hello, Mom April.
Hello, can you hear me? Good evening, Dr. Locsin. Good morning,
Hi, good evening.
classmates. Hello. I'm April Garcia, cardiovascular operating room nurse in Mary Mediatrics Hospital here in Batangas, Philippines. It's nice to meet all of you here. I'm looking forward for this interview. Thank you for this opportunity, Dr. Locsin.
Oh, the pleasure is
All.
mine.
Thank you. Thank you.
And of course, Mom Rupa.
Actually, I was able to
Oh, you
introduce
already.
myself earlier.
Oh, sorry, I
Okay.
didn't mean to interrupt. Yes.
So it's okay. I can introduce myself again. So as I said earlier, I'm working at the National Kidney and Transplant Institute as the head of the Quality Assurance and Nursing Research Unit of the Nursing Services. So I've been in the profession for 11 years, and I am really, really happy for this privilege, Dr. Locsin, that we are able to have a discussion with you today. So now that we've gone around the table, so let me share a few things about our guest for this morning. So our guest is a highly esteemed professor of nursing at Fukushima University in Japan. He is a professor emeritus of Florida Atlantic University and a visiting professor at the universities in Thailand, Uganda, and the Philippines. He is a multi-awarded nurse scholar and educator known for his theory entitled Technological Competency as Caring in Nursing, which shall be the focus of today's discussion. So ladies and gentlemen, let's all welcome Dr. Rozzano C. Let's give him a virtual applause.
Thank you very much. Yeah. Yeah. Okay. I am not sure. Okay. I would like to be sure, all right, that all of you have at least read an article or preferably the book on technological competency as caring in nursing, right? So that this interview is going to as Mr. Francisco was saying, to have an in-depth understanding of the theory. One of the basic, I've been listening to your presentation. You presented yourselves, and two things that I got was two things that are very important. One, this is not technological nursing. Okay, all right. Two, technology is used to know persons as caring. Technology is not used to deliver care, right? Technology is used to know persons as caring. It's a different perspective. Otherwise, this theory becomes technological competency is nursing. Right? That's a different perspective. The other one, which is my theory, is technological competency as caring in nursing. So the focus is you do these technologies in order to you use technologies in order to know persons as caring. In doing so, you can participate in the care. So we use the word deliver, right? So when we use the word deliver, that's one way. Okay, it seems as though you, the person, or you, the nurse, knows everything about the patient when actually you don't. Okay, so the purpose of that technology is to know the person as caring person. Why caring person? Because this theory, the first assumption, I have 5 assumptions in this theory. First assumption is that all persons are caring by virtue of their humanness. All right, so all persons are caring. All right, and so many times people would ask the question, how about the rapists? How about the murderers? Are they caring persons? Right. So my answer to that is yes, they are caring persons. However, their expression of caring is different from how we understand caring is. Okay, so how caring is expressed in nursing is different as how these rapists, these murderers express their caring. They care for themselves, they care for their family, or whatever it is that they are caring for, right? So we are all caring persons, but the expression of caring is different. This leads us to the idea that technological competency is an expression of caring in nursing. Okay, that's the essence, right? And then the second assumption is that all persons are whole and complete, right? Nothing is missing. Okay, even if you are, see, it's a philosophical perspective that is derived from simultaneity paradigm, if you like to put it that way. Okay, from Rosemary Parsi, or you can look at it from a unitary transformative perspective, which is from Newman, Sime, and Corcoran Perry. These are paradigms in nursing, not meta paradigms. Okay, again, I'd like to differentiate that. Meta paradigms in nursing would be your nursing, health, environment, and health, right? Okay, that's meta paradigms by Jacqueline Fawcett. Here we talk about nursing paradigms. Nursing paradigms are the lenses through which you can see nursing. Okay, that's the whole idea. And paradigms, you may have heard the word paradigm shift, right? Paradigm shift comes from was designed by Thomas Kuhn. Well, designed or addressed or proposed. Okay, because Kuhn, Thomas Kuhn, the scientific revolution, right? So this is a perspective that we are all involved in today, right? Since 2020, we've been involved in this revolution of care, right? Revolution of nursing, due to the pandemic, right? So this revolution, right, allows us to know more about what is nursing. Okay, so Thomas Kuhn is responsible for us. How to put this? Is responsible for that idea, so that we can explain why we are looking at different ways for us to nurse. All right. So enter technological competency as caring in nursing. Okay. The third assumption focuses on nursing is a discipline and a profession, right? Meaning, as a discipline and a profession, we have our own body of knowledge. We have which we usually call nursing science, right? And so we nurses are the scholars and the researchers who develop our nursing knowledge, right? And so it behooves us to consider, when we do research, we research nursing phenomena, not healthcare phenomena, not physical therapy phenomena, not health phenomena, right? Because that is a different discipline, okay? Not medical phenomena, especially, right? Although our orientation in nursing has always been that nursing is a medical profession. It is not, okay? Some 60, 70 years ago, that has changed. We are not a medical profession. We are a health care profession. Medicine is also a healthcare profession. These are some of the things that we need to we have to change, because if we continue to say that nursing is a medical profession, it perpetuates the idea that we are practicing medicine, we are practicing nursing, and we have our own body of knowledge. And so nursing is a discipline and a professional practice, right? And so these assumptions support the idea of the theory, which is technological competency as caring in nursing. Okay, so remember that very well. All right, it's not technological nursing. It is not technological competency as nursing, right? But it is technological competency as caring in nursing. Okay, it goes back to the first assumption, which is that all persons are caring. So you would like to know, who are these caring persons, right? In doing so, you are able to practice your nursing. And this theory has three processes of nursing. Okay, the biomedical model of nursing has its own nursing process, as you call it: assessment, planning, intervention, evaluation. That's a biomedical model, right? And there's a historical perspective to that, which is that 60, 70 years ago, nursing wanted to be a professional practice, right? But we didn't know where to go. We understood that, nursing is like medicine, but we cannot be physicians, right? So we have to have our own practice or guide for practicing nursing. So enter the nursing process. If you look at the nursing process, it is much like how physicians practice medicine. They assess, they plan, provide intervention, and evaluate. Okay, that's exactly what they do, right? So when they assess, you have your IPA, inspection, palpation, percussion, auscultation. Then they have a diagnosis. We have our own nursing diagnosis too. And that was another way by which nursing can enter into a whole perspective of what happens when a person's desire for care is influenced by the biomedical aspect of the human being. Okay, that's why it's important for us to understand the philosophical perspectives. Okay, one philosophical perspective is that all persons human beings are made up of parts, right? And so when you say a human being, you have to have the completeness of parts. The summation of parts equals the human being, right? Another perspective is what we call the historicist, or the historicist perspective, or the human science perspective. Okay, so the positivist philosophical perspective looks at human beings as made up of parts, and so our purpose, right, or all those biomedical professions, their purpose is to make the person whole again. Okay, that's the idea. All right. So something is missing, you provide it. So if you remember Orem's theory, right? How does the nurse practice nursing using Orem? You have wholly compensatory. If the patient cannot do anything, so the nurse will do everything. Okay, that's wholly compensatory. They compensate. If the person has some abilities, so partly compensatory. And if they can do that, then the third one would be educative, supportive. That's Orem's theory. Okay, so it's grounded in a perspective of completing human beings. Okay, but the other perspective would be like persons are always whole, and that is where this theory comes is grounded in. And that's so you look at the paradigm. The nursing paradigm is unitary transformative, right? or simultaneity paradigm. And when you study Rosemary Parse's theory, you are going to be you're going to look at this. Right? Rosemary Parse has two paradigms: totality paradigm and simultaneity paradigm. Newman, Sime, and Corcoran-Perry has three, but this particularly deterministic, interactive integrative, and unitary transformative. Right? So this goes into the unitary transformative. That's the lens through which you can see nursing. Okay, that's a good I would say representation. Okay, or analogy, the lens. Right? So you put on a different lens, right? So you can see nursing this way. Okay, so that's those are the paradigms. Paradigms are perspective or viewpoints. Okay, those are the same words, the same terms. Okay. So how does the nurse practice nursing using the theory, right? So I know I hope you were intrigued by the idea of, so we have all these assumptions, we have all this perspective of persons are caring. So how am I going to practice nursing? Okay, so I have three processes. One is technological knowing. Okay, right. So remember, the purpose is to know persons as caring. Okay, that's the statement. So you are going to use technology in order to know persons as caring. Okay, that's very important. And in doing so, you practice your nursing, right? Nursing does not mean bed bath, bed making, IM injection, and so on. So those are just the skills you use in order to know the persons more fully as persons. So if you are in ICU, right? So you have all these gadgets, all these technologies. What is that for? Yeah, so that you can know the person as caring person, because your understanding is that all persons are caring, correct? I mean, this is the idea. See, assumptions, right? The assumptions are the foundations through which your practice can be held or can make real. So so technological knowing is the I would say the initial. Okay, then you go into mutual designing. Okay, what do you do with mutual designing? Now, many times when we use the biomedical model or the nursing process, we plan, right? Plan, provide the interventions, etc., etc. So we make a nursing care plan, but that is one way. Okay, it seems as though you know everything about the patient. You don't. You can't, right? Because human beings are unpredictable, right? They are irreducible, right? So they will only allow you to know who they are and what they are in the moment. Okay, and a good evidence for that would be, okay, so you take the blood pressure now. After 30 minutes, the blood pressure will change. They are never consistent. Okay, and that becomes a problem when you're a nurse educator, right? So your poor students, right, will be taking the blood pressure and goes out of the room and looks for the clinical instructor. By the time the clinical instructor comes, the blood pressure has changed, right? And so it becomes problematic. So anyway, the point is, persons change, right? Biophysical, biophysiological perspectives in context also change. They are not permanent, okay? So they are unpredictable. That's the essence. If you become predictable, you are a robot, right? You can't, right? So hopefully we don't have automatons. We don't have nurses who are automatons. Although some people say, oh, there are many of those in our unit, right? They just do what they're told to do, okay? Anyway, so and the third one is participative engaging. So you have technological knowing, mutual designing. Mutual designing is that you enter the world of the other so that you can know the other as caring person, right? This is a very, I would say, a tricky situation. Why? You see, people say, how would you enter the world of the other? Remember, when you enter the world of the other must allow you to enter, okay? You cannot force yourself in. If the person does not allow you to know who he or she is, they will just tell you whatever you want to know. but that is not what is really the perspective of this patient. Okay, so you should be able to know who these persons are, and that this person must allow you to know who he or she is. So remember, I know in your studies, in your undergraduate studies, the one topic would be establishing rapport, right? Rapport is a very is a critical term when you want to communicate with your patients. In the same essence, right? You would be able to establish rapport, or when the patient allows you to enter their world. Okay, and so you must have that intention, right, to enter the world of the other. Only then will you know who he or she is in the moment. Yeah, the technology will tell you, right, will tell you the blood pressure, will tell you all these things, but you don't really know who this person is. Now, and if you notice, there are research studies that say, okay, when the wife is present, right, the blood the physiological measurements are normal. When the wife leaves, now you have changes, and so why? Because the world has changed, right? There is the significant other is not there anymore, right? So we have to remember that when you, especially those who work in ICU or intensive care units who limit visitors, right? We have to consider this. Even pets nowadays. The use of pets is very popular. Pets are also considered as technologies. What is technology in the first place? Technology is anything that makes things efficient, all right? So anything that makes things efficient is technology, right? And so just imagine, I always use this. If you have a wheel, right? When you say wheel is always round, right? So bicycle is it becomes efficient. What happens if your wheel is square? Very inefficient, right? So this is an idea that anything that makes things efficient is technology. So like medications, pharmacotherapeutics, vaccines, they are all technologies, right? And so we come to know persons as caring persons, right? When it comes to research, okay, remember I mentioned earlier, what should we study using this theory, right? We should be studying, I have established two priority phenomena. Being cared for, right? So what is it like for persons being cared for with technologies, right? For example, patients in ICU, patients with prosthetic devices, patients with bioengineered pancreas, patients with transplanted organs, right? What's it like, right? We don't know, right? Why? Because we don't have transplanted organs, unless anyone has, all right? Then you can tell me what it is, right? So you have to ask, okay? So you should know what is it like caring for or to be cared for is one, okay, with technologies. So these are the patients. So what is it like to care for patients who have technologies? Okay, so that will be from the nurse's perspective. So you have two sides, which makes things a bit better when it comes to understanding technological competency as caring in nursing. Okay, so you have two phenomena that you can study. You can use either quantitative or qualitative, but these are most of my research studies are qualitative in nature. It's more phenomenological. But in Japan, Dr. Tanioka has designed and developed and tested the technological competency as caring in nursing instrument. There are many, right? They have, I think there are to date there are probably 4. Okay, there's a revised one, there's a one pertaining to patients, one pertaining to something else. And just to let you know, this instrument has not been translated to Tagalog. Okay, so if anyone is interested, you may want to use that, all right, to determine whether or not nurses are technologically competent and their expressions of caring. Okay, then the next question would be something like, what would be the value, okay, the axiology, what would be the value of having technologically competent nurses, right? What's the value, right? Is it simply efficiency, right? Or remember, the purpose of nursing is the patient, right? It's not the nurse, okay? It's always the patient, right? So whatever so job satisfaction is one, but patient satisfaction of care is actually the priority. So how can we facilitate patient satisfaction, okay? By having technologically competent nurses, right? So it's a and then how do you know they're technologically competent? Now you're going to use the TCCNI, right? And that's available online. There are probably 2 or 3 articles. If you just search in the internet, it's available, so you can use that. Okay. I think I talked too much. Go ahead, ask questions. Sorry.
No, no, no. It was quite interesting listening to your discussion, sir. Actually, some of the questions um have been covered in that discussion. I was
Thank you.
gonna ask about some theoretical influences, but and thank you, by the way, for rectifying and clarifying the about what I've spoken about technological nursing, and for rectifying that. Indeed, it is absolutely different from the concept of technological competency in nursing. Um, so if I may, I do like to ask, because I've come across a number of articles in journals relevant to your theory, and one of the statements that did caught my attention was the statement that the ultimate expression of machine technologies in nursing turns out to be autonomous robots. I think you mentioned that earlier. And with future potentials of functions comparable to human persons. Would you care to expound on this, Dr. Locsin?
Okay, all right. The development of the theory has now actually has I would say has engaged theoretical and practice perspectives in a kind of spectrum, right? On one end, you have or if you can call it a dichotomy, but actually it's more of a spectrum. On one end, you have the humanoid robots or healthcare robots, for that matter. It doesn't have, well, you can have healthcare robots that are not human, that are humanoid and not humanoid, right? And then on the other end would be the perspective of human beings as persons, okay? And in between, you will have your cyborgs, right? Your cybernetic organisms, because they're the combination. But the idea is perhaps you're trying to ask the question: Will humanoid nurse robots be important in our practice of nursing in the future, or will they be relevant? Right? Will humanoid nurse robots be relevant in our practice of nursing? Now, it actually another question would be: Can we be replaced by robots? Right? And to answer the second point, I would say yes, we will be replaced by robots if our practice of nursing, okay, the condition is if our practice of nursing is simply predictive, okay, which means if it can be answered by algorithms, yes, no, yes, no, yes, no, yes, no, my robots will do a perfect job, right? But I would assume and I would hope that nursing is more than simply a predictive action. For example, if you use the biomedical model, right, the nursing process, for example, it's predictive: assess, plan, intervene, and evaluate. Right. So you have that prediction. It's a prescription, right? I actually use the word prescriptive. Right? And if it is prescriptive, the robots can be programmed to do the care, quote, the care that you are supposed to be doing. That's the answer to the question of can we be replaced. So how can we remain relevant in the future, right? We meaning human nurses, right? Well, we have to practice nursing more than simply through prescriptive and to prescription and prediction. So nursing has to be more than that. Now, the next question you're going to ask probably would be, what will that be, Dr. Locsin? Right.
Yes, that will
Well,
be. I was wondering what would be the role of nurses and other healthcare professionals. Should we get to that sort of point in the future?
yeah, excellent question, because what happens will be, we don't know the future, right? We don't know the development. What we know is that technological advancement is rapid, right? And so many people say, oh, human nurses can never be replaced by robots. I beg to disagree, because they say, oh, they cannot express emotion. I said, I will disagree, because we now have affective computers. We now have quantum computers, right? So we now have all these humanoid robots, right? That they actually dress up like nurses, and that's another perspective. They dress up nurses as if all nurses are women, right? When I would say, well, probably 15% of nurses are actually men, right? So the idea is we need to rethink the idea of what nursing is. Not the nursing of today, but the nursing of the future. So the nursing of the future involving humanoid nurse robots may be, right, having robots as participants in the care, right? All right, or we will have humanoid nurse robots who will be our supervisor, because they'll have very fast thinking. Okay, the computerization will now be based on complexity science and chaos theory, not the ones and zeros anymore, right? It will be complexity science and chaos theory, unpredictability. Schrodinger's theory can support that, the quantum mechanics, quantum physics. But anyway, so their thinking will be much faster than us, right? So they may be they can solve faster problems, faster questions. But how nursing will be practiced will depend on you. You meaning the younger generation. Was it Generation Z? Because we are boomers, right? Then you have the millennials, and then you have Generation Z, right? And so how would you look at nursing in the future? What is it? Given what is today, what is the future of nursing? And so will nurses and nursing be better practiced with humanoid nurse robots as participants in the care, or will it be better if they become supposedly our superior, not our slaves, right? I'm just using representative terms, right? Or do we need them, right? And so that's an excellent question, is do we need them? When I was presenting in a conference in Indonesia, one question was, why do we need robots? Same thing in the Philippines. Why do we need robots when there are so many nurses, right? So exactly, I would say, I don't think we need robots in the Philippines. Why do we need them?
Which leads me, if you would allow a hypothetical questions here.
Okay.
Yeah, so I do have I'm quite interested in that, what you spoke of the latter about how whether we would need the existence of humanoid robots or robotic nurses in the Philippines specifically, because I don't I'm sure you're aware of how mass resignation among healthcare workers is a threat and a growing concern in the Philippine healthcare situation, as COVID cases surge, as we are in the middle of a pandemic. Suppose the Philippines does have the capacity to deploy robotic nurses, what do you think would be the implications to this? And I think you've already mentioned some bit about how it would risk making nurses, specifically Filipino nurses, to be no longer relevant to practice.
Well, they may. Again, it depends on administration, and there are a couple of you who are administrators. It depends on administrators. How are they going to perceive nursing, right? perceiving nursing as doing, simply doing, right? Then you can assign robots to do those things, right? But if your administrators would say, oh, we need more than simply doing, right? Because then we have to do something, take decision making, the human aspect, and what other perspective that we think the human thinking, right? I have yet to be convinced that artificial intelligence will replace human thinking. Okay, many times we think of artificial intelligence as replacing thinking, but I don't think that's thinking. Right? Thinking, I think, is a human trait. Maybe that's the
I
best
think
word I could have.
it's really solely a human function. I think,
I
you know,
think
being
so.
yes. Thank you, Dr.
All right.
Locsin. So with regards to technological competency, I understand that some individuals, you know, like how, and I mean, you mentioned that technological competency is an expression of caring.
Right.
Some patients, may not be open to this, but how would you personally help patients or convince them to view technological competency as an expression of an expression of caring?
You mean the nurse being technologically competent?
I
How
mean,
would you convince patients that nurses ought to be technologically competent?
is
Is that what you're saying?
how to convince patients, sir. Because I know some patients' perceptions may be like, you know, like in my own experiences at work, because a lot of the tasks involved in where I work involve a lot of technological use, and some of the patients' concerns. One of a few of them have raised that they said the nurses take too much time dealing with devices, with paperwork, they spend a lot of time on the computer, that that they don't feel like they're being cared for adequately, or because they don't
Excellent.
have that sort of interaction.
Right.
I hope that sort of makes sense, Dr.
Yes,
Locsin.
I understand what you're saying. Now, see, that's one of the things that we have to understand is, and I think Patricia Benner addressed this very succinctly. The novice, from novice to expert. That's her book, right? So a recent graduate will always focus on the technology, okay? Because these are all technologies, so they want to be competent. And I would assume every nurse who is given a new technology should understand and appreciate how this technology can allow him or her to know the person more fully as person. Okay, so not to be a technological expert simply because you want to be a technological expert. No, it's technological expertise in order so that you can use these technologies to know the person more fully as person. Okay, if you're practicing this theory, right? And that becomes a problem if the patient feels that you, the nurse, is focusing more on the technology rather than on the patient. Actually, there's a very good nursing situation, I call it, that talks about this. Right? I happen to have that the book. This is one of the poems that are there. It's a story of a patient, right, in the intensive care unit and the nurse, right? So there is this conversation. It's called intensive care for all matters. But the idea is that you need to focus on the technology for the purpose of knowing the person as caring. That's the idea. If you lose the person, right, the person will know it. Okay, the person will know it, and so the person will say, "Well, what can I do? The nurse is only nursing the technology."
Yes, that I think that was one of the
Yep.
statements, expressions made at one point. But we did, like you pointed out, it goes back to the purpose and intention of why you're utilizing that technology, and it
Yeah.
gets said in knowing that person and helping that
Right.
person,
Yeah.
and in the
And
process
the,
of
and the,
getting
and the
towards recovery.
critical word that you used, intention. Okay, the intent to care. Right. You must have the intent to care. Otherwise, if you don't have the intention to care and you don't have authentic presence, right? Authentic presencing. So you are there because you want to be with the patient. You want to know the person more fully as person. If you are there and then you're thinking about, something else, right? Like, oh, am I going to go to the movie with my sweetheart or my girlfriend? Sweetheart is an old term. With my girlfriend or whatever, right? So it's a different story, right? So your purpose has changed. It's not the patient anymore, right? So the intent to care is very important, and that's another topic that you may want to consider in terms of studying nursing and nursing theories. There are,
It is
yeah.
quite intriguing, doctor.
Mm.
So since we are talking about as well with like being like the idea of technological expertise among nurses, um, so using your theory as a theoretical lens,
Mm.
in practice, what do you think about nurses who are, I know because I'm sure not all nurses are the same. Some
Mm.
nurses
They
may be
better not
resistant
be.
to changes. Yeah,
They better
they
not be the
resistant to
same.
technological changes and may be unskilled or less, less open or less skilled in technology. Would you say that are they to be deemed to be less caring?
Mm.
Why or why not?
Okay. All right. See, nurses who want, okay, who want, because you have to want to work in settings that are highly technological, must understand that they have to know the technology, right? But okay, if you don't use the technology, if you don't know the technology, you don't have the competency of technology, you are not being a caring person, right? Because you are not to be a caring nurse or a caring person. Why? Because in this particular setting, what is demanded is that you have to be technologically competent. And if you are not, you have no business being there, right? For example, I mean, this is another perspective. So here comes a nurse who comes to the intensive care unit, lying on the bed, right? And the nurse comes and then holds the patient's hand, and then the patient says, "Nurse, can you tell me what my EKG is what the EKG monitor is telling you?" Right? And the nurse would say, "Oh, it's okay. Don't worry about that. I am here for you." That is not appropriate, right? It is inappropriate, right? It's well, I don't want to say an expression of an uncaring person. There's no such thing, right? Because we're all caring. But then the idea is that is not what is required. That is not what the patient wants, right? That is not what the patient wants to know. So you are not facilitating the care of the person, right? You are
Yes,
not,
yes.
okay, because you don't
And I
have the
can,
competency.
yes. Yes, and I also can see from your example that I think that goes against the concept of mutual
Mm,
designing that you're that like having the patient having the patient nurse work jointly work together in that
exactly.
process. So
Right.
so if you're not involving him, like making him aware, like yeah, if the patient asks about what how would you explain to the patient what is EKG, what it means to him, yeah,
Right.
because that is one way of knowing him. I'm sure he of
Exactly.
course he also I think I believe I was as a patient I would be interested to know what it means through my
Hmm.
nurse.
Right.
Thank you so much, Dr.
Very
Locsin.
good. Very good. Yeah.
Yes, if so I've got another question. Um it's pretty current. You know as we are uh as we are all affected by COVID at the moment. So I see seen that nurses, would you agree nurses as promoters of health?
Mm,
And at the moment, we got these COVID vaccinations being rolled out. So you mentioned that technology as is anything that makes efficient and it makes anything efficient. So like and you mentioned vaccines are examples of these. So so there remains a challenge with people who do not wish to be vaccinated and
mm.
those who are against vaccinations, or I think what the term is the anti-vaxxers. So, can the theory of technological competency in nursing play a role in remedying this crisis in healthcare? Because I know a lot of the nurses, in as they try to promote the idea of they promote for people to get the
Mm.
vaccine. So how do you think this year would help and
Very good,
its
very
and
good.
their role of helping
Yeah,
also?
very good question. Okay, very good question, because then you ask the question, who are these persons? These persons are caring persons, right?
Hmm.
They are caring. Their expressions of caring is not the same as our expression of caring, right? And so what are you going to do, right? What are you going to do in your role, therefore, your nursing practice, therefore, is to make the person understand and appreciate that which is meaningful to the person. This is what we call personhood, right? Living the meaning of one's own life. What is the meaning to them by being vaccinated or not vaccinated? Okay, we have to understand who they are as persons, because that is how we practice our nursing. Okay, because we are all caring persons. So what do you need to do at that moment in time? All right. So you can, by knowing the person, is this person amenable to knowing about vaccines at this moment, right? Because you cannot just go ahead and tell everyone, oh, this is the vaccine, this is mRNA, so no, right? Because they may not be ready to know, they may not want to know, right? So you cannot do anything about that. You will only create conflict, okay? And you will have a big, uh, um, uh, you will have to call the police, right? To separate you, because then you have your own opinion and then the other opinion. That's not it will not go anywhere. So there will always be opportunities. The point is, we don't we have to do more than simply waiting. Okay, and that's another phenomenon that you may want to also study: waiting to know. Right?
Waiting to know. That's really interesting. Yes.
Yeah, waiting to know. For example, you got pricked by a needle, and then you happen to know that the person has HIV. Right? So what happens? Or COVID, for example, still waiting to know. Okay, exposed to a patient. Okay, or a person who was found to be with COVID. What is it like? Okay, to be waiting to know for 14 days, right? Because you have to be on quarantine for 14 days, right? And there are actually studies going on about that as well. So that's another perspective. Anyway, so that's as far as technology is concerned, and as far as vaccinations are concerned, we need to understand who they are as persons, right? Usually the government will dictate, and that can be used in your explanation of how it can be done. Then you also have the religious perspective that makes them say, no, I don't want to have a vaccine, because they say vaccines are developed from fetal material or whatever it is. Okay, so there are so many reasons, and then it's less than 5 years. I said, if you're going to wait 5 years, we will all be dead, right? So, but that's a very bad way of expressing, of wanting to convince people, right?
Yes. Yes.
Okay.
But thank you, Dr. Locsin.
Mm.
Uh, sorry, I think I've been asked a lot of the questions, but these questions are in these are some of the questions that have been agreed as a group for us to ask you.
Okay.
I would like to invite the other participants, the other members, if you got any questions that you'd like to ask Dr. Locsin.
Yeah. Hi, Dr. Locsin.
Yes.
So thank you for those astonishing insights. Personally, I admire the wealth of your researches, those that you have done and
Thank you.
implemented. On that note, I would like to ask you if you can cite a particular research that you have done that prompted or supported on your theory on your theory. Sorry.
Yeah, one of the things that there are actually 2 or 3, or probably more than that, research studies studying the phenomenon of being cared for, right? Or being cared for with technologies, and caring for persons with technologies, right? And I think since you work at National Kidney and Transplant Institute, There has been I think a couple of research studies looking at patients' experience of being of having kidney transplantation, right? And you can search. I don't have the names of the authors at the tip of my mouth, but they have done that, and there are different perspectives. Like you can also go through older persons who have who are experiencing hemodialysis, right? And you can have other younger people, for example, younger patients, and you can look at their families, for example. So these are all brought about by having technology facilitating or living, allowing them to live their lives meaningfully as persons. Okay. Okay.
Thank you very much.
Thank you. It was very insightful, sir.
Oh, thank you.
And any yes, I think I see Sir IG raising his hand.
Sure. Okay.
Thank you so much, Dr. Locsin, for that wonderful discussion about the theory. I believe this is a mid-range theory, which is this is applicable mainly on a day-to-day basis of the nurse action. Do you happen to think that this theory could be used to provide a checklist or an assessment on the recruitment for nurses and for their deployment to several ward or units? Because you've mentioned as well that the technological competence as caring of nurses varies if they are novice nurses or they are expert nurses. Yes. So, and also there is a wide range of movement in the nursing employment. Even nurses with 5 years of experience or 10 years of experience, sometimes they move to another facility. So I think I wanted to know if you happen to think of a real life implementation of technological competences, like as a checklist or as an assessment for recruitment. Thank you.
Yeah. Actually, there is an existing. Actually, there are 2 or 3 versions already of the technological competency as caring in nursing instrument, or TCCNI. And you can use that. Okay, there are many versions. There's a 33 item version, there's a 25 item version, and there are translations. So as I mentioned, there is no translation as far as Tagalog or Filipino is concerned. That's one thing. There's a TCCNI that is translated to Thai, Japanese, right? One is being developed now, Bahasa, Indonesia, right? Because it's important. The important thing is that it has to. I would like to use the word touch the soul. All right, when you create the items, it's not a soulless instrument. So not only will it ask you about being technological, being caring as a technologically competent nurse, right? That's the essence of it, right? But I would suggest you can Google it. I mean, what a word. Okay, you can actually check the internet and then just write TCCNI, and I think you'll have a choice, right? I think it's a good way. And if you're recruiting, it might be if your philosophy and mission, right, of the Navy is about nurses are caring persons and practices, so and so, then you can use that, right, as an instrument, or you can make revisions to it, right, and then you have to do your reliability and validity, etc., because the instrument has changed, and then the participants have changed, or respondents as you call it, right? So you can use that. It's there, right? You can make changes to it or revise it to suit what it is that you want to know, right?
Thank you so much, Dr. Locsin.
Okay, all right.
Dr. Locsin, I believe you mentioned something about the nursing process, the whole process from assessment to evaluation. That it's, as you know, it serves a guide to nurses to deliver patient care based on expected outcomes. I understand so that you have expressed that nursing that is guided by this cause-effect routine is dictated solely by prescribed procedures and by accomplishing, it's like sort of a checklist of nursing tasks. Um, so would you kindly further share your thoughts on that? So, I mean, is this more, so is this more of, I'm not gonna say against, more like, is it more like the way what do you think of the nursing process
Mm.
as compared to your, to this theoretical model?
Okay. First, when you say nursing process, there are many processes of nursing. Okay.
So, I
So
mean,
that
the ad pie
no,
process, sir.
yeah. I understand. I'm just making a clarification. Okay. So there are many, and
Thank you.
no one thinks there's another process of nursing. People think that it's only one nursing process. That's not true. Almost all theories of nursing have they're all or has almost all has uh, uh, a process of nursing. Okay, so that's an important thing to say. For example, I mentioned orem. For example, how does orems? If you practice orem, you have your holy compensatory, so on, so on. So Rosemary Parsi has his own. Okay, Boykan and Shona First Nursing as Care, they have their own. Okay, process of nursing. So the nursing process was established, as I mentioned earlier, to lift nursing at supposedly the level of like medicine. Who else, right? I mean, that's how that our level of standard is medical practice. So we wanted to lift that. How are we going to do it? So we copied and we made revisions, right? Even in our nursing diagnosis, right? We are actually it's the same as a medical diagnosis, right? We just stated it differently. So when you say so when your nursing diagnosis is what's the
Altered body
alteration
alteration.
alteration in circulation related to hypertension. Well, essentially it's hypertension, period, right? So but we make it different. Okay, so to make it appear like it is nursing. Okay, but what can you do with hypertension? There's really nothing you can do. All right, what can you do with hypertension? Administer medications. All right, now you become a dependent practitioner because you cannot administer medications unless it's ordered by the physician. Where's the autonomy there, right? So that's just one of the things. So, but it's very difficult because I know you have to pass the board exam. So when you teach nursing, it changes, right? And when people like JCO, for example, I think Dr. Hirial is going to be is listening and is going to think about this seriously, because then your nurses actually look at the nursing care plan as the end all be all, right? Once you have created your nursing care plan, which is based on the biomedical model, assessment, planning, intervention, evaluation, then the nurse is ready, right? Okay, to practice nursing. That was important 60 to 70, 80 years ago, right? Because we didn't have any. Today we have many nursing theories that have their own processes of nursing. Okay, and so if you're going to adapt, okay, if you're going to adopt and adapt, right, then the whole system has to be attuned to the idea of caring. Okay, if that is what you want. Okay, because caring is just one of the sciences in nursing. Caring science is just one of the sciences in nursing, right? You also have biomedical sciences in nursing. No problem. All right, but it's just a different theoretical perspective, right? So I'm not saying it's not good. No. Okay. What I'm saying is there are other alternatives. There are other truths, if you like to put it that way.
Yes.
Right? Because there's not only one truth. Okay. There's not only one theory. I hope that
Yes, yes,
That
it does.
answers. Okay.
It does. So, provide answers to what I've asked. And sort of like it's more like you said, it's all different truths, and that sort of how
Mm,
you would choose that would affect. Would you utilize this in practicing nursing? To
right.
speak of, nursing practice, I was quite also intrigued with the concept of entering into the world of the other, like the nurses, to such an important nursing, would you say function, nursing function, in knowing persons?
Mm. Um,
Yes,
okay.
yes, Dr. Locsin, you
No,
were
no,
gonna
go
say
ahead. Go
something.
ahead. Finish your question. Sorry.
So basically my question is that so what applications or how do you see this theory or an element of this theory to benefit individuals receiving mental health care, because it is such mental health care, mental nursing is such an important aspect of nursing, or aspect of human health, especially it's a big sector, actually. It's a big and controversial sector here where I'm at in the UK. So
Yeah.
I wonder what your thoughts and insights into that.
Right. Well, excellent question again. Right. So the idea of nursing persons who have mental and psychiatric problems. Okay. So remember, it's nursing of persons who have mental and psychiatric problems. They're not psychiatric patients. They're not cardiac patients. Right. So we have this new movement today. Right. That is person first. That's the term that they use. So you don't say diabetic patients, right? You have patients with diabetes, right? It's the patient who happens to have diabetes, right? So the idea here is that um, when you come to know the person, right, who has mental disorders or mental problems, the person is still a person, right, who has not lost his humanity. It's just that it behooves us to understand what is this person's situation. I think that's or condition, right? We have to understand that because we have that is how we can participate in the care. If we don't understand what is happening to the person, then we cannot participate in the care. Remember, persons are participants in their care. They're not objects of care. Okay, so they even if they have mental health problems, they participate in the care, and you, who are supposed to be the expert, should be able to understand what it is that is necessary or needed in this particular situation. Situations will change because human beings are unpredictable. Now they may have a mental condition, right, or mental or psychiatric condition. It doesn't mean they are less human, right? And so if all persons are human by virtue of, but if all persons are caring by virtue of their humanness, then your care, right, your nursing must be based on that assumption. If you want to use technological competency as caring in nursing, does that make sense?
Yes, thank you. So that makes so much sense. Thank you, Dr.
Okay.
Luxine.
Mm.
I'd like to ask the other participants. Have you got some questions for our guests? Ma'am Rufa, have you got any questions? Um,
Yes. So actually, Dr. Locsin, this is not
Yeah.
related to the theory, because we all know that you are very much established in your career as an educator, as a researcher.
Mm.
Well, would you care to share some of your secrets into how you have become this successful? We are very much inspired by all your achievements, and what are your advices to us who are still starting in our careers, or those of us who are still with reservations on which nursing career path to take?
Um, I, I, that's a good question, right? Because we often say, oh, how come these people are up there? Yeah, so. But that's not the point. The point is your willingness to unknow so that you can know, right? If you have a closed mind, it's the end. Okay, right? So when I studied at UP, right, all our perspective was all quantitative. excuse me, it's quantitative. There was no qualitative research at the time that I know of, right? So the idea was simply prediction, and because remember, nursing theory, you have four purposes, okay? To predict, to prescribe, to explain, and describe. Predict and prescribe, quantitative research. So you have your level of significance, you have your 0.05, whatever, 95% of the time. Then you have explain and describe, which is your explanatory. You have your phenomenological research, survey, ethnography, grounded theory, etc., right? So that's how you develop our care, that we develop our own caring science. So we must unknow, right? Open our minds and know so that we can know, right? This is also the same when we practice our nursing. Okay, we may have known about a person who has diabetes, right? But this person is different. No two persons are the same, even twins. So their experience, their understanding of the disease condition will always be different. So you, as nurse, must come to know who this person is. Okay, so you open your mind or your way of knowing so that you can know the person as person. Okay, so you have to unknow in order to know, and do not assume that you already know. I already know. I know the pathophysiology of diabetes, so I know who this person is going to know. Okay, because it's going to be different. Okay, the priorities of that patient will always be different than your priorities. Okay, I hope that answers.
Well, that was quite insightful. I think I think that's one of the important things I'll probably take home with me. Like, it's important that to unknow to know. That's really really insightful, sir. So I guess you pretty much covered our questions, and so pretty wraps up what we have here. So I'd like to, so on behalf of, so as the leader group and on behalf of the group, I'd really like to thank you, Dr. Locsin, for your time and your astonishing insights that you've shared with us.
Thank you.
We hope to enlighten, so in this project, we do hope to enlighten others with your work. And personally, I guess I speak for all of us, that we wish you all the best with all your future endeavors. We are looking forward to hear more. Actually, before into the interview, I was actually browsing through my phone about looking for a book on your theory.
Yeah.
I know, but I did come across some journals, but I didn't realize that there was a book that we can actually look into. So that's something I add to my reading list this week.
Very good. Okay.
Yes.
Yeah. And so once you read it, then you can have more say more understanding is probably a good way of saying things, because we cannot know everything. Okay.
No.
So that's not possible yet. Okay,
No,
maybe in the
it is,
future we will be able to know everything. Okay, but that's not possible yet.
perhaps an autonomous robot, sir.
Yeah, or a post-human. Okay, we are in the transition, right? That we are in the transhumanist perspective, going to the post-human.
I do think it's not that very distant. Yeah, the idea we are already in the age of experience anyway. Like, people, I think before the information of age, when people with with their status updates or knowing more information, now people are all about experiencing things. I think we're actually gearing to that sort of direction in the future. So
yeah,
yes.
and that's one of the things that nursing should move towards. Okay, and one thing though that I hope you guys will really do it is, nursing almost always react. Okay, we are not proactive, right? We always follow, right? Why? Right? We always follow what is presented out there. Why can't we not create our own path? Let them follow, right? So I always ask that question because we need to do if we are a science, there's nursing science, then we can create a path of our own so that nursing can be realized as integral to human health and well-being. So I'd like to end this with a question,
Yes.
if you allow me. The question is something like this: will there be nursing, right? Will there be health? Will there be healthcare or health if there are no nurses or there is no nursing?
That is quite the question, sir.
If you remove nurses and remove nursing, will there be healthcare or will there be health? If you say no, right? Why? What does nursing contribute to health? If you say yes, right? Well, what does nursing contribute to health? See, that question is, I would think, is a heavily laden question, because it points back to what is nursing, the ontology of nursing, what is the nature of nursing, right? We have to move past the idea that nursing is doing. It's more than that, I hope, because anyway.
Yeah, and yes, and I totally agree with that. With what you said, Dr. Luxine, and also about instead of just like in being a follower, like following prescriptive actions. Like I think we, as nurses, I think we should be in that sort of position or role, to challenge ideas, like to explore more, and like what so like say that if so when it comes to interventions and stuff, like you need to challenge why, you need to question, is there a way for me to do this better, more efficiently? So I think that that sort of mindset will actually help us unearth more that is within the nursing discipline.
Correct. Yeah.
Yes.
So I'm just happy. Okay, I'm very happy, not just happy, but I'm very happy that people are looking at. I mean, nurses and other healthcare professionals are actually looking at this theory more than ever before. If you look at this theory was initially the seminal, the germinal, the germinal article was published in 1999. I say germinal because the politics of seminal is masculine, right? Germinal is more general, so that's why I was corrected, because I always say seminal. So seminal is masculine, semen, masculine.
It's more
So
gender neutral. It's more gender
okay.
neutral, I believe. Yes.
Yeah, exactly. So it should be germinal. That's the word. So you ask yourself the question: what happens to seminary? Right. So anyway, that's a joke. Okay. So anyway, so the point is, 1999. Then the book was published in 2005. And what is now, right? 2021. Actually, 2020 was when I had a lot of questions asked, a lot of all these things coming out because of COVID, and the idea of technological competency on one side and the humanness on the other side. Okay, so yeah, it's nice. So I hope you will share, right? Share your understanding, disseminate the information, and don't let anyone
Most
curtail.
definitely, sir. Most
Right.
definitely. It's been
Right.
it's been quite an informative and inspiring discussion, if I must say. And
Thank you.
again, the group on behalf of me, I mean me on behalf of the group, sorry. It's like 3:30. It's that part. It's that time of the morning on my shift. It's 3:30 in the morning on my end here in the UK.
Right.
Um, and then we thank you so much for agreeing to this interview. And again, I hope the best with your career, and hope we get to hear more of your theoretical works.
Yes.
I've been as I was doing some research, I do have come across some latest works. I think what you mentioned about the different versions of the tools in measuring technological competency, that I did come across some versions of that. It's really
Very good.
interesting, and I think
Yeah.
that would be something really useful for me and other from my colleagues, if they ever decide to use your theory as a framework in pursuing other studies. So
Right.
yes, thank you so
Yes.
much, sir.
Thank you very much,
Thank you
sir.
so much,
So,
and thank you for the time and all those other stuff. So thank you.
All right.
sorry, before we
So
end,
thank
can
you.
we take a
Yes.
picture?
Oh yes,
Can you
of
kindly
sure,
course.
open
no
your
problem.
cameras for documentation purposes?
Yeah,
If possible.
those alien freers. Okay.
Okay. So
All
one, two,
right.
three. Smile. One more. Okay. Thank you very much, everyone. Thank you
Right.
very much, Dr.
Thanks.
Thank
Locsin.
you, everyone. Thank you,
Okay.
Dr. Locsin.
Take care of yourselves. All right.
Take care.
Thank
Good
you.
luck. All right.
Nice
Say
seeing you
thank you
all.
to Dr. Bonito. Okay.
Yes, sir.
All right.
Thank you.
Okay.
Thank you.
All right.
You're
Bye.
welcome.
Okay.
Bye-bye.
You too. Right.
Hi, everyone. What is the position?
Hello.
Thank
I
you
guess we
po.
can pause record. Okay. I guess we can pause recording. Ma'am Rufa, do you mind just pausing recording on your